Already signed on and may be listening to us. My name is David Cruz. I'm in Los Angeles today. Juan Proaño is executive producer of this national conversation. And we have with us Dr. Genoveva Oyervides McNeil. Is that correct?
Oyervides O'Neill. Yes, sir.
Dr. O'Neill, thank you. She's in Washington State. If you would like to participate, we have a chat box that is open and you can obviously submit questions or comments there. I would ask you to maybe keep your statements brief and then get to the questions so that we can get as many questions in as possible. Our purpose in being here with you today, obviously, is in bringing you an opportunity to hear from the content experts, the people who have the answers, people like Dr. McNeil, who is out there on the front lines where it all began right here in the US, in the state of Washington. Doctor, as we wait for others to arrive, what's your day like this week?
This week, well, I'm in the maternity ward. So we do a lot of catching babies and seeing newborns, as well as taking care of sick kids. I'm a family medicine physician by training, so we do a little bit of everything.
I know that you're also on the faculty of school or schools in Washington State. Tell us about your teaching role in the state of Washington.
Of course, yes. So I'm on the faculty as a clinical teacher for the Washington State University, University of Washington, as well as Oregon Health Sciences University. And I am in charge of the curriculum development for first, second, third, and fourth year students through our residency program. So after medical school, we do almost like an apprenticeship. And that's what residency is. And we oftentimes have learners from various parts of their training. And we use that time not only to teach them, but also to teach each other and keep each other at the very tip of what's the newest thing coming out in medicine. So it's a wonderful place to be.
Dr. O'Neill, thank you. Thank you very much. I misspoke earlier, but I'm glad we get the opportunity to hear from you today. So, as we look around the nation today, the impact of COVID is so different. We've got a whole spectrum of impact. In the state of Florida, of course, the situation now kind of beginning to pick up more and more intensity there. The epicenter has been, it started, of course, in your state, Dr. O'Neill, in Washington State. Juan, are you able to comment also on the situation there in your state of Florida where you're located?
Sure, go ahead, Dr. O'Neill.
Okay. Well, here in Washington, currently we've had about 8,384 positive COVID tests. And to date, we have 372 deaths. Currently in our hospital, we have 16 patients, and one of them being taken care of by our team here, by our resident learners, who are also full physicians. So initially, we had a little bit of a lag time between getting to really understand the situation and getting all the testing, getting all of the protective equipment that we needed. But our organization was really great at transforming into a more of a direct response situation. We're expecting, according to some models that were projected by the University of Washington, to see kind of the peak of this wave happen within the week or in the next 2 weeks. So right now we're still awaiting to see how that situation is going to pan out.
Dr. O'Neill there in Washington State giving us the latest on her situation. I was just thinking as you were speaking in terms of getting past the peak, but we shouldn't relax our guard and think we're out of the woods because there is no vaccine for COVID-19.
You're absolutely right. And another thing along those lines is that we don't know who has the COVID-19. Some people do get very sick, but we know as well that there are people who are not showing any signs or symptoms who may also be at risk of passing it on. And that is why it's so important to remember to wear a mask when you're out, to cover your coughs, to isolate from situations where you will be around people, and to keep about 6 feet away from each other.
Wonderful, wonderful. So as we go through this conversation today, and I hope that we're going to be joined by Ramiro Cavazos here shortly, and also our national LULAC president, Domingo Garcia, and U.S. Representative Joaquin Castro, we hope to be able to give the participants today and the attendees an opportunity to interact. Now, you say that you're in the obstetrics ward, the maternity area of the hospital, and yet I would imagine when parents-to-be and when families arrive, top of the mind for them must be this coronavirus. What are the things they're asking you?
That's a great question. Yes, we see a lot of people arriving using masks, using gloves, and just very afraid. And on one hand, they have certainly more than their reason to be so, because mothers being immune suppressed during pregnancy, as well as these little babies that are now going to be exposed to our uncertain environment. So some of the questions being, is my baby at risk for getting COVID just from being in the hospital? Some questions are also, should I breastfeed my baby? Because I don't know what's going to happen. So the way that we have been dealing with all of this is developing an algorithm to screen out who is sick, who is showing symptoms, and who is at risk, and isolating those people from each other. We currently have folks that are checking temperatures of every single person that comes into our hospital, whether they're a visitor, a physician, or some other essential person, to make sure that we're not missing anybody who is symptomatic, to minimize the disease spread. Sorry, go ahead.
That's okay. I didn't mean to interrupt. I just wanted to reset the stage. We're being joined by more and more people. I want to welcome our guests also from Brazoria County Hispanic Chamber of Commerce. We hope to have people from throughout the nation, and they can participate as well. You're listening to Dr. Genoveva O'Neill. She is in the state of Washington. Juan Proaño, our executive producer, the man who put this together, he is in Miami, Florida, and my name is David Cruz, and I'm in Los Angeles. Are we all isolating? Has it changed the way we spend our days? How do you handle that, doctor? Because you're one of these individuals who's there providing an essential service. Let's face it, babies don't wait. So how do we handle the situation of you having that close proximity with families? And we're joined by the Honorable Congressman Joaquin Castro, who's relaxing at home. Congressman, thank you for being here.
Yeah, thank you for having me.
I appreciate it. So, doctor, to that point of your proximity to patients, how do you handle that and keep safety in mind?
So that's another great question. What we do is we make sure that we're using our masks, that we are certainly keeping track of and making sure we have enough of. But the best thing that the public can do is really to stick to these isolation guidelines. The CDC has come out with these for a reason, not just to protect you as a person, but to protect others. That is one of the biggest and most important things that you can do to keep us on the front line safe.
Well, thank you. And I really appreciate that you mentioned keeping one another safe, because what I do will impact you in the community, wherever you are. And so we want to be respectful of each other. Also, welcome to the Farm Worker Career Development Program, the Indian River State College. We want to welcome them. Well, Congressman Castro, I know that your days are jam-packed, and we did get advice early on that you may be called away if there is some development in DC where you must attend to that call as well. So let me just open the floor as we wait for our national LULAC president, Domingo Garcia, to join us. What are things like in San Antonio? That also has been one of the places in America that's drawn quite a bit of attention. How would you describe the situation there in your district, the 20th district of the great state of Texas?
No, well, thank you. And thank you all for doing this. And thank you for having me. I am at home with my wife and my two kids in San Antonio. And just like everywhere else, people have been very anxious, stressed out, dealing with both the public health emergency and then also because businesses have closed and workers, some of them have been laid off or lost their jobs. People are also dealing with the economic reality. So over the last few weeks, my office has received about 2,000 calls, most of that having to do with people who are trying to get through to apply for unemployment benefits. So we've been trying to be very helpful there. And then also Congress not too long ago passed the CARES Act, which we can talk about, and is now getting ready to do another round of stimulus funding to get the economy, to get people stable, and then ultimately to get the economy up and running once we've defeated the virus.
Congressman Castro, if I may, this is a nonpartisan organization. However, this morning, Senator Bernie Sanders announced that he was not going to continue his race. Any reaction from your viewpoint, your brother having been himself a presidential candidate? What would you say is the landscape now as we go towards November?
Well, you're right. I was the chair of my brother Julian's presidential campaign, and so we had a chance to see Senator Sanders' operation and the operation of the other candidates up close. And Senator Sanders, even though he never became the nominee and never became president, has had a more significant and meaningful impact on the course of American politics and public policy than even some presidents of the United States throughout history. So he's still, of course, serving in the United States Senate, but regardless of what happens from here on out for him, he has left a very powerful and incredible legacy in terms of reorienting how the country thinks about healthcare challenges, about education challenges, and about our economy and the workforce.
Well, as we set the stage here, we're merely a few seconds away from the official start of the program, but we came on early to make sure that all the technology was working. I want to personally thank, as a point of order here, I want to thank Juan Proaño, our executive producer. Juan, you've done 3 presidential town halls. Now you do this, probably the largest national conversation on the Latino impact of COVID-19. Your perspective on what you're picking up from your viewpoint. You've done a lot of research, and you're a researcher, you're a strategist. What do you see?
Yeah, I mean, it's really been impacting Latino communities disproportionately, certainly from a labor perspective and from an economic perspective. I am a small business owner myself. I have gone through the process of signing up for the SBA Disaster Relief Fund. I have signed up for the PPP program as well. That process is kind of sort of slowly developing, but it's been very difficult, when you have staff, people that depend on you, and also other organizations and businesses that depend on you as a small business owner. So my hope is that it continues to develop. Obviously, we're paying very, very close attention, but this is just something that's very personal to me in regards to our community. My youngest daughter, Penelope, who is 3 and 6, who just ran across here, she also has type 1 diabetes. And so, we've been very attentive to, this issue of preconditions around diabetes. And so we've been sheltered in place, at home, huddling together, but, also concerned about, our family, my mother, who I haven't really seen in the last couple of weeks, and also my wife. Her grandmother's 96 years old. And so she lives alone, very independent as well. And so making sure that she has everything that she needs to. And we know that other people are also in the same situation as we are.
Thank you, Juan. As you were speaking, we're being joined by a whole flood of folks, and one of them is a bilingual teacher in Las Vegas, Nevada. And she wanted to acknowledge that she appreciates mentioning education. Congressman Castro, how do you wrap your mind and your arms around such an enormous undertaking when you're making and voting on those disbursement of funds for education, for food, for the kinds of things that keep a community, a nation alive? What's been going through your mind and heart?
Well, I mean, this is obviously new for all of us as Americans and as legislators. For the economy to come to pretty much a halt is something very unusual and unprecedented. And so figuring out for each segment of society, whether it's our educational institutions, our healthcare institutions, individual workers, small businesses, industries, how you make sure that once we've beaten the virus, or beat it back at least, that those are able to bounce back. It's been a monumental challenge for everybody in Washington and in the state legislatures and cities across the country. So, I'm in my 4th term in Congress. I served 10 years in the state legislature in Texas before that. And it goes without saying, this is unlike anything that I've dealt with during my political service, public service before.
Damas y caballeros, voy a traducir algo de esto también al español, ya que tenemos personas que se están uniendo a la conversación de todo el país, a nuestros amigos en la isla de Puerto Rico, de costa a costa, a través de los Estados Unidos. Bienvenidos a cada uno y todos de ustedes, porque la conversación que aquí estamos emprendiendo esta tarde tiene que ver con el impacto de este virus. Me da tanto gusto también recibir al distinguido Leroy Cavazos Reina, de la Cámara de Comercio Hispana de los Estados Unidos. Mr. Cavazos Reina, thank you for being here. Your perspective as the small business advocate across the United States, Latino businesses who are being told, yes, we have money coming, hang on. How do people hang on? And we're being joined right now by President Domingo Garcia. But as he sets up, let me ask you this. Briefly tell me, how is the Chamber seeing the outlook for small businesses?
Well, first of all, thank you so much to LULAC for collaborating with the United States Hispanic Chamber of Commerce. Collectively, we are the voice and advocates for the Latino business community. We represent over 5 million Hispanic-owned businesses that combined contribute over $800 billion to the U.S. economy each year. And there is help on its way. A lot of it is already being dispersed. We're asking people to be patient, to be sure to be reaching out to your bankers if you're looking for help on the payment protection program, reaching out to the SBA if you're looking for disaster relief loans. And our president and CEO, Ramiro Cavazos, will be with you guys shortly to further discuss these programs.
Thank you very much. Damas y caballeros, damos la bienvenida y el inicio a este su programa de información. Será bilingüe al grado que podamos con el tiempo que nos hemos aquí reunido. Let me please welcome the National President of the League of United Latin American Citizens, Domingo Garcia. Bienvenido, señor presidente. We'll need to unmute the microphone.
Bring up to date what's going on. One of the things that this pandemic has shown is the almost apartheid system of healthcare that we have in America today. We've seen that here in Texas, for example, Latinos are the largest uninsured group, ethnic group in the state of Texas. But this goes through Nevada, through California, all the way across the country. And the fact of the matter is they're not getting the health care they need. And in fact, what we're seeing also is the almost caste system economically, where a lot of Latinos who are on the front lines, these are the men and women who are putting their lives on the line for America. The farm workers in Arizona and California who are putting those vegetables on our plate. The meat packers that are there in Iowa, Nebraska and Colorado, many of them without the protections they need are indicative of battle that we're facing now. And that's what this town hall is about. So I'd like to show you just a couple of things just to get started. If you will, Juan, let's go ahead and start with the first slide.
Sure.
So we here at LULAC have been studying the issue, and we've talked to experts in economics, medical, as well as social, and come up with a couple of numbers that I think are important that you see now. We are on the front lines of in the fight against the COVID-19 vaccination. Latino doctors and nurses are everywhere. We're the ones that are still working in the restaurants, that are doing the to-go orders and the deliveries, and having to do so with less of medical conditions. At the same time, Latinos are extended families. La abuelita, el tío live with mom and dad and the kids. And so we need to protect them, and very susceptible to this type of disease. We have extended families living together. And these are pictures that were taken at a meatpacking plant last week in Marshalltown, Iowa, where Latino workers who are doing, when you eat that ribeye, when you get those fajitas, the carnitas, these are the men and women that are doing it in these kind of conditions. No face masks, no gloves. And in fact, at this particular plant, over 5 of these men are now been tested positive for the coronavirus. And we are working and filed a complaint with OSHA to make sure that these meatpacking plants start following the law, start following the protocols of the Centers of Disease Control, because they're the ones that keep the meat and the chicken and the poultry and the pork going to our grocery stores at H-E-B or Kroger or Albertsons.
Nos dice el señor presidente Domingo García que estas fotografías que estamos viendo ilustran cómo nuestros trabajadores, los campesinos, las personas en los empaques, en los restaurantes, están trabajando en situación muy congestionada y dice, ¿dónde está la protección para ellos? Por eso nosotros en LULAC estamos registrando quejas con el gobierno federal demandando que ocurran y que se lleven a cabo cambios en esto, señor presidente.
And for example, this is a food bank line in Sunset, Florida, right outside of Fort Lauderdale. The line of people trying to line up for food, 8 miles long down the freeway. And this is happening at food banks across America. And we are seeing the toll that is taken on Latino families, many who are living paycheck to paycheck and have savings maybe for a month and no more. So we need a safety net to protect these families in the future. Just to give you an outline, these are some of the headlines just from last week and this week about the conditions of these frontline workers. They're just as important as a doctor or a nurse at the hospital because they're the ones that bring the food and the drinks to the grocery stores, but they're not recognized. They're unsung American heroes and they need to be protected and taken care of. And any new stimulus, Congressman Castro and the rest of Congress needs to make sure that they're included. They get no sick pay. We heard stories of a man at the Greenlee meatpacking plant. He got sick. His temperature was 104 degrees. And his supervisor told him, Juan, if you don't come to work, you don't get paid. So one has to make a decision. Do I come to work sick and maybe get everybody else sick and get a check? Or do I stay home and not have a check and then my family can be evicted and I won't have food on the table? Those are choices that shouldn't have to be made, and that's what we're seeing. So LULAC has a plan for combating basically the racial inequalities that we're seeing. If we don't have equity in the government response, then we will not be able to beat this pandemic. And what we're seeing is that low-income and minority communities are disproportionately affected by the coronavirus. We have a lot of people with diabetes, high blood pressure, heart disease, and those secondary symptoms make them more likely to suffer. Here in Dallas, Texas, Latinos are actually the largest number of positive coronaviruses, with African Americans a close second. And we're seeing in other cities, Chicago, New Orleans, and New York, that African Americans are disproportionately being impacted in deaths and hospitalization, and Latinos are second. So that we need to have a plan that deals with those statistics, because those are not statistics. That is abuelitas, abuelitos, tíos, tías. Those are real people, not just a statistical pool. That's why Latinos need to be part of the testing pool for any new virus, any new testing, because normally Latinos are type O, most Anglos are type A and B, as well as African Americans. So we need to make sure any vaccine, any treatment includes Latinos as part of that test group. We're also looking at how we're going to combat the issue of the 22 million students that are now at home depend on the free lunch program. Latinos are almost 1 in 2 of Latino children qualify for free lunches. And if they're not getting their breakfast or their lunch at school, then that's going to fall on the families to get that food to them. And that's going to be an additional cost to them that many families just don't have that extra money for that much more groceries. So we have to get those schools to have drive-by pickup meals for families. Some school districts are doing it, some are not. They're testing behind scores. They're telling that Latinos need to take homework from home. Many Latino families don't have a laptop. They don't have an iPhone that they can use so that their kids get studied, and that means Latino students can fall further behind. That means the high-tech companies need to come forward and provide free laptops, free iPads for Latino children so they can keep up with their peers in the educational system. And they cannot, Congress needs to act to make sure that our children don't go hungry and that we take care of those that are working from home or taking their education from home. Communities are clearly the first to lose their jobs. We're the last hired, first fired. And that is continuing, and we're seeing that in the coronavirus. 49% of Latinos have been cut or laid off of the total Latino population that's working right now. Only 33% of non-Latinos have had a pay cut or been laid off. That's a 16% differential. That's big. That means that we are going to be impacted disproportionately, economically, by what's happening. So that's why we're supporting our agriculture workers and pushing OSHA to enforce strict worker safety laws so they don't get sick and be laid off. We're asking for unemployment benefits to include all workers, including undocumented workers. 13 million half of them are working in these fields of agriculture, meat packing, pork, and groceries and truck driving. And those are part of the lifeline of bringing the food supply to America, and yet they're not covered. So we need to make sure that the next bill, which I understand may be voted on Thursday, includes support for undocumented workers. And we're supporting that they get sick leave and unemployment.
Thank you. Thank you. And of course, this entire presentation, esta presentación completamente la vamos a tener en el sitio de lulac.org, lulac.org. Is there a key closing point in your opening comments, Señor Presidente, you want to give us, and then we'll round robin this?
Well, again, it's important that we work together como una familia, that we make sure that we put pressure on Congress, but also states, counties, and cities to open up any type of programs for small business, for unemployment, and make sure that they're included. I also want to talk to you about the people in detention. Many immigrants are still being detained by ICE in detention centers. Many of them need to be released immediately. Their only crime is they came to America looking for the American dream. These detention camps can become death camps. We already seen that many detainees in New Jersey have tested positive for the coronavirus. This was given to them by the staff at ICE. We're seeing ICE officers testing positive. So we need to make sure that we deal in a humanitarian manner with those detainees that are older, over 50, women that are pregnant, and children, and that they be released immediately. So I think that's kind of where we're at.
Gracias.
Quiero todo el público que se apoye a nuestro plan de acción y vamos a seguir trabajando con todos.
Gracias. Damas y caballeros, lo que el señor Domingo García nos ha relatado, en parte, es el impacto que está teniendo este virus en nuestra comunidad. Un ejemplo, casi la mitad de los trabajadores latinos están sufriendo impacto, ya sea descanso o recorte de horas, en comparación con la gente no latina, que solamente 1 de cada 3 ha sido impactado. Con eso, vamos a conducir aquí la palabra al congresista Joaquín Castro. Congressman Castro, you've heard some of the data. Interpret that for me now into how you will advocate to make sure that we are not left out or left behind.
Well, and those are great points by Domingo. And he's right. We found some interesting statistics about Latinos in the American workforce. 84% of Latinos don't have a job that allows them to work from home. And at the same time, as Domingo mentioned, a disproportionate number of Latinos in the workforce have been let go or laid off from their job. Ironically, undocumented workers and others who don't have a social security number, even though we know that there are a handful of major American industries that would not exist the way they do, but for immigrant labor, including undocumented labor. These are folks who pay collectively billions and billions of dollars every year to the United States, into the United States Treasury. And so far, through the stimulus relief bills, they're not going to be able to get any kind of check. You know, most Americans are going to get a $1,200 check for themselves, $500 for dependents. Folks without a social security number were left out of that, even though we've seen them as essential workers now, like the farm workers who are still out there in the fields. So one of the Congressional Hispanic Caucus's priorities is to continue to push to make sure that every worker in American society, regardless of their immigration status, benefits from the relief packages that Congress is passing.
Lo que nos dice aquí el congresista, quiero traducir en parte, tenemos personas de la Florida y Puerto Rico también que nos están urgiendo que hablemos también un poquito en español. Quiero compartir con ustedes. Él dice, él va a trabajar como otras personas de la delegación hispana del Congreso de los Estados Unidos para asegurarse de que nosotros no quedemos fuera, especialmente cuando 80% de los trabajos que nosotros llevamos a cabo no se pueden hacer en casa, o sea que estamos trabajando al aire libre, estamos trabajando en los empaques, en los sitios de negocio. Congressman, there has been a lot of talk about how we weren't ready to help small business. Please tell me that we're not going to see trabas and obstáculos and barreras thrown in our way. We don't want to see obstacles, barriers, and new underhanded kind of last minute changing of the game, if you will, and our communities, businesses do not get help. Help me with that.
Well, in Congress, in this last, what is known as the CARES package, the last round of stimulus legislation, allocated about $377 billion for small business relief. A lot of it in zero interest or close to zero interest loans, forgivable loans, and then grants. And bear in mind that for the Latino community, Latinos, when they own businesses, they tend to be small business owners. We do have some people that own larger companies, but by and large, it's small business owners. So if they've had to shut their doors and they want to reopen and they need to access cash to do that from the government, it's important that these programs be available and accessible to them. So that's one of the things that we're watching as the SBA rolls out and as the lenders roll out this program, is to make sure that the Latino community is taken care of.
And I want to welcome now, he's been quite busy today. I want to welcome the CEO, President and CEO of the U.S. Hispanic Chamber, el jefe de lo que es la Cámara de Comercio Hispana de los Estados Unidos, Ramiro Cavazos. Ramiro, thank you for being with us. Respond to those words from Congressman Castro. Are you seeing movimiento? Are we getting help? ¿Nos van a dar ayuda, sí o no?
Buenas tardes a todos. Perdón que llego poquito tarde. Excuse me for joining late. Thank you to President Garcia and to everyone on the panel. Thank you, LULAC, for your broad shoulders as we move forward. It's a privilege to be on this panel with you. I want to respond to the comments that were made by our distinguished chairman of the Congressional Hispanic Caucus, Joaquin Castro. And Congressman, thank you for your leadership. At this time, as he was saying, many of our small businesses, they're fragile. They have 27 days of working capital on average, and many of them employ Latinos. And of the 30 million small businesses in America, 4.5 million are Hispanic-owned businesses, but only half of them have a relationship with a bank or a banker, and which means that half of our 4.5 million owned businesses are in trouble right now. They're trying to figure out how to pay their rent, how to keep their employees on, and they're having to really struggle with getting the resources. Most of the information is not in Spanish. Nosotros hemos estado trabajando muy duro para pasar la información en nuestra página del internet y para darles la información clave que necesitan para el PPP. Entonces, para nosotros estamos de acuerdo con LULAC y el congresista. We need liquidity now for our businesses. It's not an insolvency issue, and for many of them, they don't have the ability to get the lending that they need. This program, it's a plane that is flying, that is being built, and even the SBA itself, when the Treasury put on its website the application for application for the PPP funding, even the SBA itself did not have the information that it could provide to the bankers and the lenders out there. And even the bankers, if you ask our bankers at community banks or CDFIs, they didn't have the details of what was needed in the loan documents to even move forward with this process. So we are in agreement that we need immediate cash to our small businesses now, or lending that is forgivable. They also need help with their payroll taxes. If we don't do something now, as the congressman said, we could easily lose 1 out of every 4 of our Latino-owned businesses, and 2 out of every 4 are already saying that they may be temporarily closed. So for us, this is life or death for our members, and we have 250 Latino chambers in America, and they're an oasis in their community for information, and even they may be one-person shops or small volunteer-driven organizations. So at this time, we need to be loud and to be organized. And again, I want to thank LULAC for your leadership.
Thank you.
And it's an honor to be on this panel with each of you.
Gracias, señor Cavazos. Quiero darle la palabra. I want to give the word here to Dr. Genoveva Oyervides O'Neill, who is in Washington State. We were having a brief introduction right at the top of the program, but I want to come back to you, Doctora. What are you seeing in Washington State, where it really started here in this country? ¿Cómo está la situación? How is the situation there in Washington?
So thank you first of all, for having me on this panel. I feel very privileged. So I wanted to share a little bit about our experience here. So I work personally in essentially the mission arm for Peace Health Medical Center. So we have 85 to 90% of our folks that are Medicaid and Medicare. I also volunteer for a clinic that we only see undocumented folks. What we've been seeing is just fear. There is so much fear from disinformation, from just, in addition to already being a marginalized community, as Latinos, we also have limited access, which also, with the threat of COVID-19, has just been almost paralyzing to some of our patients.
O sea que lo que está diciendo usted es que el temor casi está dejando a nuestro pueblo paralizado. Is that keeping them from coming to see you and getting necessary testing and treatment?
I think to an extent it most certainly is. The other part of this is, do we even have the testing available, which has been quite the conundrum, at least here in our state, having enough of the testing materials, taking way too long for those tests to come back. So in between all of that, in addition to not having resources in the language of their preference, it's been a very big challenge to reach out to our Latino communities.
Dice que ha sido un reto muy grande porque falta la información. Ustedes pueden ver aquí el panel que tenemos de expertos. Quiero regresar con el presidente García. Domingo, you have been very active. I know you've been talking to governors, you've been talking to the White House, you've been talking to members of Congress. ¿Qué le dicen los líderes? Are they getting it? Are they understanding how important? We don't have time to wait for promises. We need action now. What are they telling you?
Well, I spoke to the governor of Colorado this morning. Hold on just a second. We got some issue here. We got the governor of Colorado regarding the issue with the meat packers in Greenlee, Colorado, and the situation that we're in. I have a scheduled teleconference with the Surgeon General of the United States on Thursday. And we're trying to figure out what is the best way to make sure that Latinos are at the table. That we're not in the little kids table, we're at the adults table dealing with the issues, because we are being impacted disproportionately. And unfortunately, we're still not seeing that, for example, that SBA money that Chairman Cavazos was talking about is getting down to that taqueria, getting down to that quinceañera dress shop that is losing money because there are no quinceañeras now. The weddings that have been postponed. All of that has a ripple effect through all our economy. People depend on those businesses. So we need to make sure that funds get there. And then again, those frontline workers across America, construction workers, and so on, that they are being taken care of with sick leave, unemployment leave, and that they're given access to insurance. One of the things that this has shown is that the inequities that we've seen, the income inequities, the healthcare inequities, the inequities on how government treats us needs to be rectified. We need like almost a new deal like Franklin Roosevelt had in 1939 in terms of from 29 to 39, in terms of making sure that everybody is put to work, because you ain't gonna fix a pandemic if you don't have equity.
Nos están diciendo, there's a question from Adriana Linares for Congressman Castro, if I may. She wants to know if we're going to be able to get USA data to the points like what Ramiro Cavazos was speaking about as the head of the largest advocacy organization for small businesses owned by Latinos in America. Are we going to be able to truly get the demographic impact this is having on Latinos in the United States, Congressman?
Yeah, we're pressing the Trump administration to give us data on the impact on businesses across demographics, but most immediately on different populations, because we've seen a disproportionate number of people of color in different states who have been affected by this virus. So we've been pushing the administration very hard to disaggregate that data for us as it's coming in, so that we have a clear picture of what's going on economically and in terms of our healthcare.
Entonces, señorita Linares, ya le contestó el congresista que sí estamos procurando nosotros recaudar y tener acceso a las estadísticas y los datos. And to that point, Mr. Cavazos, if I could again, you touched on something very important. You're saying 2 out of every 4 Latino-owned businesses will be impacted or may not survive. Please drill down on that a little bit.
Well, it's very clear, Mr. Cruz, that our businesses are small and they're fragile. And of the 4.5 million Hispanic-owned businesses in America, 90% of them are self-employed businesses. They're a person that files a 1099 each year. That's why, as the congressman was saying, we need to get these dollars out there to our small business owners that are Latino and Latinas, because they need to cover themselves and their family and their rent and their costs and their payroll taxes. So we are micro businesses, the majority in this country, but these are businesses that are employing other folks in that larger 10%. And many of those businesses are not banked as well as they should be. We all know that in this country, that depending on the neighborhood your business is in, determines whether or not you are bankable or not. And as I was saying earlier, that 1 out of every 4 Latino-owned businesses already in this country is thinking of closing, but 2 out of every 4 are thinking of closing temporarily until the time returns for our economy. For us, como Cámara Hispana de Comercio, tenemos que darle el respaldo a nuestros empresarios pequeños y minoritarios, porque como dijo el presidente García, que me promovió a mí a chairman, pero yo soy el CEO. My chairman is Carmen Castillo, and she is a small business owner. She's a woman-owned business. Our board of directors are very concerned that this lending is not getting into the hands of our Hispanic-owned businesses in many communities throughout the country. We are the future of America's economy. Prior to COVID-19, our Hispanic-owned businesses were generating $2.2 trillion, more than 10% of our nation's economy, which was the largest economy in the world. So we cannot lose these businesses, because these families will then struggle. And for us, we need to get that liquidity in there. And I appreciate the congressman's fighting in Washington for us, as he always has fought for us, to make sure that both sides, the Trump administration and also the leaders in the Democratic side, that we get that relief immediately to our Hispanic-owned businesses.
I see. Now, Juan, did you say you had a small business question coming your way, or we're getting so many? Let me say this. One of the things that they want to know is the racial breakdown of COVID-19. Ramiro Cavazos talked about the business impact. Let's go to Dr. O'Neill. Doctora, you said 85–90% of the people you're serving are Medicaid. That doesn't mean that they're all Latino. They could be African American. This is cutting across all socioeconomic strata, all ethnicities and races. But obviously where you are has a lot to do with who you see. So my question is this: ¿Qué será el impacto a largo plazo? Long term, what is going to be the impact of this COVID-19 pandemic?
Well, that as yet is hard to say. However, we do know a few things. The people that have been named as essential personnel during this outbreak are unfortunately also the people that are underpaid and underrepresented. Those people being the campesinos, the undocumented workers, all these people that don't really have the option to work from home. So they're putting their lives at risk, and they're actually putting the rest of us at risk because they can't do the self-isolation. They are low income at the baseline, and now with this outbreak, they are living paycheck to paycheck, if not worse. So we need to, I think, have changes come from above, where we can incentivize and give these people the sick leave that they need, allow them to take the time off, so that way we don't have this ongoing pandemic. Right now, we're trying to just clamp down the bleeding, but at this point, it's going to have to be better from here on forward so that we can prevent this from happening again.
Let me reset our panelists today. Damas y caballeros, quiero reintroducir o presentar de nuevo a las personas que están con nosotros: el presidente nacional de la Liga de Latinos Unidos, LULAC, el señor Domingo García, está en Dallas, Texas; el honorable congresista del estado de Texas, Joaquín Castro, que también fue el jefe de campaña de Julián Castro para la presidencia; Ramiro Cavazos, que ahora es el presidente y el ejecutivo principal de la Cámara de Comercio Hispana de los Estados Unidos, la doctora O'Neill, ella está también en Washington State, y el productor ejecutivo Juan Proaño. Domingo, in 2008, we saw the greatest economic displacement of Latinos in America. Now, and you have been on this every day, I know because I've heard you, we are seeing the potential, again, displacement of Latinos, not just for the COVID-19, but if we don't get the help, if we don't get the support from the various powers that be, business and so forth, what is the future like for this community, and what can LULAC do to continue fighting as we have for 90 years?
Well, again, it is true. I mean, if I don't know, they're giving us new dates all the time. We're now probably looking at June 1st in Texas before we even go back to semi-normal, and that's going to have a devastating impact on, again, on our businesses throughout the United States. And it's very important that we be ready to get up and give a hand up to all those businesses. And this is where I think local government needs to step up. For example, the Milwaukee in Wisconsin, of all places, just put up $5 million in small business loans and said, even if you were undocumented, you could apply. California, I think, is doing the same thing. So we need to make sure that even at every level that we're able to provide resources to our communities to be able to get themselves up. Like I said, a lot of people don't even think about it, but when your daughter has a quinceañera, these businesses depend on the quinceañeras, on the weddings. The businesses that depend on construction, the people that are building those bridges and roads that the truckers are using to deliver the food, to deliver the vaccines, to deliver whatever needs to be done on the medical side, masks, and so on. Those workers need to be considered essential frontline workers. And we as a country need to make sure that every level of government, from Washington to the state capitol to the county and city seats, are able to help our community get back on our feet, because there is going to be a lot of pain. And I saw a stat, 40% of all Americans didn't pay their rent on April 1st. 40%.
So Congress,
that's going to be a big deal as we go forward, because a lot of them are Latinos. We are the ones that have the fewest homeowners, and so they're renters, and we got to take care of them. And maybe a campaign with rent support, or waiving the rent for a period of time of 90 days until people get back on their feet.
Thank you, President Garcia. I want to remind everyone who's tuned into this program that this conversation is being recorded so that we can replay it for you at LULAC.org. You can see it there. And I also want to say to you that we have multiple resources, recursos múltiples para nuestra comunidad. Vaya usted a LULAC.org, LULAC.org. Ahí tenemos una variedad, un sinnúmero de ayudas. Joaquin Castro, congressman from the 20th District in Texas. Here's the question. Some have said this issue has been politicized. I know in the beginning there was concern about how are we not prepared? El país no estaba preparado. Let's move past that and look forward. I want to ask you, between now and November, and you know why, there's an election on the horizon. How do we keep this pandemic from being politicized and we deal with it as a unified nation? What will you do?
Well, I think that all of us need to focus on making sure that we're socially distancing, that we're taking all the precautions we need to so that the virus doesn't spread, and basically that we come together to beat it. And then after that, that we're able to rebound economically, that people are able to go back to work, small businesses are able to reopen their doors, and this country can get back to quote unquote normal. I think all of us as Americans, that's what we hope for, and that's certainly what we should be working toward.
Thank you, Congressman. A dual question. Monica is asking, and also Carlos, first of all, and this is for Ramiro Cavazos, I want to make sure that the payroll situation is handled from a loan perspective. You talked about how we need more money for small businesses. That's one. And also, we want to encourage our community, Ramiro, and please talk about the importance of the census in the context of providing the economic resources for our governmental agencies and support institutions that also, by the way, can hire Latino contractors, please.
Well, I believe very strongly that with this COVID pandemic that we are not going back to where we were. And many of the folks on this call and on our panel know that we were operating at a certain level of efficiency and using technology to communicate with each other and to do economic development. And so because of this, our lives will change permanently. We will, I believe, as a community, be stronger for it. We cannot manage our way through this crisis. I agree with the congressman that we need to lead our way out of it and see the opportunity beyond. We've gone through the recession. We went through 9/11. Those of us that are a little bit older, like I am, we remember OPEC when there was an energy crisis in this country. And so this is not the first time we have gone through a challenge, and our community is very resilient. Los empresarios latinos y latinas tienen mucha fuerza, y esta es una comunidad que está preparada para lo más difícil en este mundo. We are battle tested as a community, and although we may struggle and we may lose some of our businesses, I believe that we punch above our weight when it comes to using social media, technology, artificial intelligence, and of course the internet. And as a nation, we also know that we are a young population. We're fast growing, we're innovative. We also over-index on the use of our smart devices. So I believe, Mr. Cruz, that our best days are ahead. I do think the two things before I give it back to you, our Fortune 1000 companies need to realize, and they will through this crisis, that we are their consumers of the future, their workforce today and of the future, and of course the vendors of the future. We are asking many of those companies to set up microloan funds or lending funds, and many of them have been doing it already to provide money out there where the federal government itself has not been able to provide. So that's one thing that we are urging many of our Fortune 1000 companies who support LULAC or the Hispanic Chamber or need our dollars, that you know, we don't care if we're red or blue. We're red, white, and blue as a community, but the color that we appreciate and love is the color, that's the color of money that we want to put in the pockets of our community. We need to continue to achieve great heights with our educational attainment. We have less than 10% dropout rates, which has been a big reduction. And so we are the new mainstream of our society. And we think that companies need to also, as the congressman said earlier, we need to utilize our vendors for those services, and the federal government needs to do more procurement. The largest buying service in the world is the U.S. Department of Defense, but our federal government uses our tax dollars and gives less than 7% of those tax dollars back to our minority businesses, and many of them are Latino businesses. So we are ready for this struggle. We're going to come out stronger at the end, but I think the new way of working will show that Latinos are going to be better off for it in the long run. We're going to come out stronger for this. In the short run, we need to put liquidity in the pockets of our Hispanic-owned businesses to help them, though.
Thank you, Ramiro. I want to turn to the Dr. O'Neill in Washington State. Aunque usted está en el estado de Washington, esta pregunta se la hago a usted porque es algo que nos preocupa demasiado. Nosotros nos han tratado como que somos los invisibles del país, como que no estamos. Pero aquí estamos y no nos vamos, como dice el presidente García. Doctora, ¿usted qué le dice al pueblo de habla hispana? What do you tell the Spanish-speaking population of America and Puerto Rico today about going and getting tested and accessing that health care because their life and their safety and that of their families is at stake? Could you give me some comments on that, please?
Of course. So number one, no se tienen que aguantar, okay? That's one thing that my mom tells me often, and that is very much a truth in my life. And so even if you are underinsured, uninsured, or undocumented, there should be testing resources if you contact your public health system or your local community health center. Now, the Trump administration has said that this testing would have been free. We have yet to figure out what that's really going to look like in the long run. I did see a question on the chat about how much would it cost. So as far as we know, Medicaid does cover it. And then a lot of private insurances are covering the testing. Out of pocket, we've been seeing numbers in the $100 to $200 at the cheaper end and up from there. So that puts a range out of a lot of folks that are just living from paycheck to paycheck. So contacting your public health authority is really where to start. A lot of the clinics have had now time to build an algorithm to say who is the person that needs the test, who can wait, and who needs to go directly to the emergency room.
But I understood, doctor, that there was not going to be a charge to anyone to get tested or treated. Is that not the directive that you're getting? A nosotros nos habían informado directamente de la Casa Blanca que no habría costo ni para determinar si tiene uno el virus o para tratarlo. Is that not what you're receiving?
That is yet to pan out in my experience. So sometimes it's hard to make overarching statements in that way. And then now we're having to see what the actual economic impact and the impact on people's health is. But we have yet to see that kind of rollout.
O sea que lo que nos dice la doctora O'Neill de Washington State es que las declaraciones no necesariamente se han cumplido. Domingo, una pregunta que llega de la audiencia. Carmen, con todo respeto, también nos dice, ¿estás loco? Le dice, are you kidding me? Le dice, this is political. Usted como presidente de la organización latina de derechos civiles más grande del país y más antigua, oye, ¿será política o es algo que solamente deberíamos verlo como algo médico, como se nos ha dicho?
Es los dos. La realidad es una problema médica. El virus no habla inglés, español, no es café ni blanco. Es una virus que ataca a todos igualmente. Y por eso es importante que nosotros trabajamos en ese aspecto para informar a la comunidad y darle toda la información necesaria para que se puedan proteger y el equipo necesario para que no se enfermen. El segundo punto sí es político porque la realidad es que este gobierno está diciendo quién gana y quién pierde, a quién le ayuda y a quién no le ayuda. Le vamos a ayudar a los ciudadanos americanos, a los residentes con $1,200, pero los indocumentados no les vamos a ayudar. Esa es una decisión.
Qué injusticia, qué injusticia. O sea que Domingo García talking, go ahead, sir.
I'm going to say it in English. Real quick, the government is deciding winners and losers. Which companies get support, which companies don't. Are they going to bail out the airline companies and the hotel industry, or are they going to not help out the mom and pop shops? And that's a political decision. And that's why we need to be at the table putting pressure at all levels. I encourage everybody tuning in, contact your congressperson, contact your senator, and contact your local elected officials and tell them to make sure that the issues we've been talking about
I want to remind, we also want to interject, Domingo, our CEO, Cindy Benavides, is reminding the whole country in Puerto Rico, we have online the information, tenemos la información también disponible en español. Entonces, venga usted a LULAC.org, come to LULAC.org. And Ramiro, you've heard the words both from the doctor, you've heard it from President Garcia. Tell me what your biggest challenge is going forward over the next few weeks as we try to get our hands on more of those funds for businesses that desperately need it.
Well, our biggest challenge was just shared by, I know President Garcia, and I want to commend him and the team at LULAC. Cindy Benavides is a wonderful CEO, and I get to work closely with her and the team at LULAC. The biggest challenge for us, Mr. Cruz, is getting the legislation that we need in the next round, hopefully by April 20th, that will provide funding, immediate funding directly to our Hispanic-owned businesses, and not just to Hispanic-owned businesses, but minority-owned community lenders, community banks who are putting the money out there to our small businesses to support them. We also need to support our Hispanic serving institutions that are needing support right now. Education is critical. And then also community, state and local government, as was mentioned by Dr. O'Neill, our healthcare centers are undervalued and underappreciated. And I agree with her, talk is cheap. Right now we need to see some some hechos, not dichos. And so it's really important that we work together with LULAC at the U.S. Hispanic Chamber and everyone that we have a partnership with to get the right legislation in there, get both the Republicans and the Democrats, because you know, for me, everybody is saying all the right things right now, but we're not seeing the results, and our small business owners and our community doesn't have time to wait. This is an immediate liquidity challenge for our small businesses, and many of them are needing to keep their employees employed and their businesses open so they can have the healthcare benefits that Dr. O'Neill was mentioning are going to go away. So right now, if you lose a business, you lose a support system, and you lose a lot of families that are going to need that help. So it's an economic cycle, Mr. Cruz, that right now, between the next round of CARES Act, we're going to have to put it in the legislation, the support for our community, and it needs to be quick, and it needs to be with a lack of bureaucracy.
By the way, for the information, please go to lulac.org, lulac.org/COVID-19, lulac.org/COVID-19, lulac.org y luego COVID-19. Quiero tomar otra pregunta de las personas que nos están aquí también contactando. Y una de las cosas, ya aparte de lo que es la política, también tiene que ver con el temor de ICE. No voy a preguntarle esto a usted, doctora, pero en toda su carrera, in your entire career, have you ever seen this level of concern mixed in with a hesitation to go to your facility because they feel that they're going to become a carga pública, a public charge? How are you balancing that as a healthcare provider?
Yeah, that's an excellent question, and there is a lot of fear, and so much so that we have seen volumes to this hospital go down. When usually we see a lot of folks, right now I'm sitting in the maternity ward and we have no Latinas right now. So what does that say? Where are they going? All these are questions that we just really don't have answers to at this point. And I think a lot of that is bred by the amount of fear that there was already there from the threat of ICE, but also now with this COVID on top, it just makes a person who already has limited access have less access.
May I interject another follow-up question to you, doctor? Ana Gil García nos pregunta, hay miles de personas que son médicos de Venezuela que no tienen licencia aquí en los Estados Unidos. They're not licensed. There are Venezuelan physicians who are here in the United States, many people who are eager to help. What can be done, she asks, to recruit them as volunteers in each state? ¿Qué estamos haciendo para reclutar a personas que vienen aquí de otros países, muchos de ellos latinos, que quieren ayudar, pero no tienen la licencia para ser médicos? ¿Pueden ser voluntarios?
Well,
Can they be volunteers?
At this point, that's on a case-by-case basis, and it has to do a lot with who is providing privileging to them, which organization is. Right now, I think the efforts are still in their infancy, but there's a lot of doctors that are previously retired who are getting reactivated. We're also making a lot of sacrifices where we're having specialists do a lot of our internal medicine rounding or obstetric rounding that they're trained with only in a very minimal amount in medical school. So I think those are the first line initiation, and then should we need more, at that point we might be reaching out.
Here's a question that comes for Domingo Garcia from CAM, who says, so an algorithm decides who gets care and who does not. A computer picks who gets saved? Who wrote that algorithm? Maybe that's a rhetorical question. Nonetheless, Domingo, you've spoken to what you call the institutional racism that's shown its head in this pandemic. Talk to me about the equity you want to see in making sure that our community hospitals also are getting the necessary help.
Look, it's very important that at some point what this crisis exposed is the inequities in our healthcare system. The fact that a lot of people who cannot afford health care insurance, who are not covered even by Obamacare, who are not, think about all those millions of people who lost their jobs, and when they lost their job, they lost their health insurance, if they had it to begin with. And so therefore, we need to make sure that whether it's Medicare for all, whether it's expanding Obamacare, but we need to have a more equitable way that everybody is provided healthcare. And regardless of whether you're working or not working, that you are covered so that when you get sick, you're able to be taken care of. Otherwise, when you're talking about algorithms or you're talking about triaging patients at hospitals will continue. It's much better. All these underlying symptoms, diabetes, it can be prevented when people are pre-diabetic, if they have access to medical care and a doctor. When you talk about high blood pressure or heart disease, all of these can be prevented in the beginning. Unfortunately, many Latinos and Latinas don't have access to a primary family doctor. They don't have access to any type of preventive medicine. And that's where we need to start putting our emphasis and our resources into. And that's what LULAC is fighting to make sure we do in any future healthcare bill.
O sea que lo que dice el presidente Domingo García es que la situación de la salud personal de cada persona aquí se trata ya de problemas, complicaciones mucho más a fondo, ya crónicos, enfermedades crónicas, diabetes, alta presión de sangre, cáncer, problemas de los pulmones, etcétera. Dice, tenemos que nosotros llevar a cabo transformación institucional. A question that comes from my PC and also from Rosalia, she is asking for Ramiro Cavazos, what are we doing to make sure that we're at the table with people like the minority communities, the NAACP, and how will LULAC and the Chamber come together so that the communities of color in business, Ramiro, are also going to have a say at the White House?
Well, the good news is it's a political year. It's a presidential election year. That's the good news, is that right now everyone's thinking about votes. And so I would say, question earlier, Mr. Cruz, is we need to get counted. We need to have everybody fill out the census form. We also need to get everybody registered, porque el que no habla, Dios no lo oye. And so for me,
Ni el gobierno.
Our biggest challenge is that we've had the numbers, we've had the power, we've had the presence, but we need to execute. Right now, it's our time. This is our time as Latinos and Latinas. So the only way Washington will hear us is if we make our voice known through the empowerment that I know LULAC represents us so well in getting the vote out, getting the census filled. I know we're doing our part working with Nidia Velázquez on the House Small Business Committee, and we're working also with Senator Marco Rubio and his staff on the Republican side. On the Senate side, we're reaching out to cabinet officials like Mnuchin and Jovita Carranza at the SBA. You know, we don't care what party they're with right now. We just need the help immediately. And so we are doing everything we can to be loud and noisy and at the table without physically being at the table, because
I must interject.
A virus, but we are in touch. I also want to thank Dr. O'Neill. We have more than 800,000 Latinos and Latinas in the healthcare industry risking their lives every day to support our community. So thank you, Dr. O'Neill.
We have 5 minutes left. Domingo, I would be remiss if I did not pass on. We have a question from Jose Pino and other educators. I'd like for you to tackle this. As you know, my daughter is a teacher. My wife teaches at a university here in Los Angeles and also at the Upward Bound program in the Oxnard, California campesino community. Here's the question, Domingo. We have seen inequity in education, chronic inequity, where kids today don't have access to broadband. They don't have those fancy computers. What is LULAC going to do, along with the Chamber and all of us? ¿Qué podemos hacer para que nuestros hijos no se retrasen? We don't want them to fall back on their studies over these next few months, and they need computers. They need access to the internet. Can you help me with that?
We have worked with various partners. We're talking to everybody. I think Spectrum is providing free services to children if they don't have Wi-Fi at their homes at this point. But it's going to take a bigger picture. It's going to take, we are behind. And we got to make sure that we get all our Latino children to be able to access the internet, to have Wi-Fi service in the homes. Many Latino families do not have Wi-Fi, to be able to have a laptop, even if it's a minimal one, so that they can learn from home. Otherwise, they will fall behind. And this is where we need to put, there in California, Silicon Valley has to step up. The government and local governments need to step up to make sure that if we're going to be, let's say worst case scenario, this continues for the rest of the year, maybe with break in the summer, that we have the children ready to learn and finish their courses from home, and that they have the tools and the resources necessary. And LULAC is putting pressure and having meetings to make sure that happens between now and the rest of the school year.
Damas y caballeros, les queremos asegurar que LULAC continuará ejerciendo presión e influencia en todo lo que es el sistema educativo del país para insistir que tengamos acceso al Internet. Doctora O'Neill, I want to thank you on behalf of all of us on this panel and the country for being one of those frontline health providers. We're losing doctors and nurses. It's sad. So would you today conclude with a final thought for the people? And if you could also, un poquito en español para mi gente que tan desesperada está y quiere un ánimo.
Sí. Well, I think, like I was saying before, the one thing that we can control in an uncontrollable situation is our response. So in this time when you feel like you're out of control, I just want to remind everybody to just focus on the things that as a Latino community we don't do well, which is self-care, watching out for one another, which we are great at, and just remembering to keep in contact. This is going to be our new normal for a while. So get used to it. Try to call and stay in some sort of routine every day. Get your exercise. Eat right. It's a time to kind of restart.
She was talking to me. She was talking to me, gentlemen. Thank you, Dr. O'Neill. We have 1 minute. Por favor, Ramiro, I'll give you the second to the last word, por favor.
Pues para mí es un honor estar aquí con el presidente de LULAC y todos ustedes y la gente escuchándonos. It's an honor to be here with LULAC as your business partner on social justice and healthcare issues and empowerment issues. I wanted to just share that we have many of our chamber leaders around the country listening in. We have more than 250 Hispanic chambers. One of them just texted me. Her name is Jessica Cavazos. I don't think we're related, but she's from South Central Wisconsin at the Latino Chamber. And she said that, Mr. President, that the Minneapolis community was the one that donated the $5 million of support. And she just wanted to share that for everyone. And it's a nice match and encouragement for others. So muchísimas gracias a todos ustedes. Es un privilegio apoyar a nuestra comunidad.
Gracias. Señor Presidente, you have the closing word.
Well, I'm glad we had over 500 participants, a very distinguished panel. I want to thank everybody who served on the panel. This is a historic moment in our times, whether I still put, where were you when John F. Kennedy died, or where were you in 9/11, and where were we today cuando pegó la corona, and not the beer, but la virus, okay? And we want to make sure that we are living up to the challenges that every generation has done. And I am confident, and I believe, y tengo fe, que nuestra gente, nuestro pueblo, se va a levantar y va a regresar a trabajar con todos para hacer Estados Unidos otra vez una ciudad, un estado y un país donde todos tienen las mismas oportunidades. Gracias.
Doctora O'Neill, un gran gusto. Distinguido Ramiro Cavazos, President of the U.S. Hispanic Chamber, a great honor. You carry a big load on your shoulders. We're very happy that you're there. Señor Presidente, que siempre nos recuerda hasta la victoria. Nosotros nunca nos rajamos. Esa es la cosa del latino. Vamos a continuar hacia adelante. Y mis respetos a Juan Proaño, el productor ejecutivo de este programa. Thank you, Juan, for putting this together. Mi nombre es David Cruz. Me despido por hoy. Continúen con nosotros a través de lulac.org. Have a great afternoon. Bye bye.
Gracias a todos. Gracias,
Thank
Juan.
you, David. Thank you.
Gracias.